Hello, everyone. Good to see you. This is your girl again, Falakemi Adebayo, and it's Morning Talk with Falakemi. So this morning, what are we talking about? I'm here to talk about something called cataract. I'm sure a whole lot of people have heard about cataract. They probably just don't know the physiology or the anatomy of what happened with cataract. So I'm just here to talk a brief about the anatomy of it and then the disease itself and what to do to prevent you going blind because you have cataract. So first, what is the definition of cataract? Cataract is the opacity of the lens, or we call it the cloudiness that happen in your lens of your eye. And this doesn't happen just in one day. It's a progression of disease. It doesn't happen just in one day. So before I go ahead, I would like to just explain a little anatomy of the eye and then just show you what happened with cataract. So this is the anatomy, a model of an eye. Is not original. It's just a model of an eye. It's not human being. So this is a model of a heart. These are the ciliary muscles, and this is your cornea. In between your cornea, we have your iris, and that's like the black part you see in your eye. And then we have your pupil, we have the lens itself, and then we have this, what sits down here is like a jelly-like fluid. We have your optic nerve, we have your retina sitting down at the back of your eye. So the anatomy of what happened when you see is this: your cornea constitutes about 70% of your vision because it helps with refraction. It helps to refract any image or light that goes into your eye through the iris, and then 30% of it go through your lens, and then your lens transmission that to your retina. Your retina send the transmission to the optic nerve, and then your brain interprets whatever you're seeing. So what happened actually in cataract is, as you age, um, you know, there is degeneration of some things that happen to all our body generally, and it also affects your lens. The protein in it start breaking down, the fibers start breaking down, and with time it becomes opaque, and then your vision starts degenerating. Now, before then, like I said, is a progression of a disease. It just doesn't happen in a day. We have factors that can aggravate this cataract, that makes you have cataract earlier, because by science, cataract should happen by the age of 80. But over the years, we've seen people in their age of 50, 55, 60s developing, even younger adults developing cataracts. Actually, there is congenital cataract, but for congenital cataract, that get resolved on its own, or if it's very, very bad, they get eye drop, or then they do surgery for them if it's very, very terrible. What are the causes of cataract? Like I said, old age. With time, as you age, gradually it progresses, and then it happens before the age of 80. Other factors that can cause cataract is blunt injury. When you have a blunt injury to your eye, either directly, either sharp, or surgery, because if you do surgery, is a clean injury, and if you do surgery on one part of the eye, there's possibility that eye might develop cataract. And cataract can be unilateral or bilateral. You might have it just on one eye, or you might have it on both eyes at the same time. Other contributing factor is diabetes. Yes. So if you're diabetic, like I've said in my previous videos, you need to check your blood sugar all the time. And if you are on blood sugar medication, you need to adhere to your procedures. You need to adhere to your medications. Make sure you check your blood sugar and take your insulin as prescribed by the doctor, and follow up with your ophthalmic doctor. Because if you are diabetic, you need to see your ophthalmic doctor, because with time, that diabetes can affect your vision as well, causing cataract or glaucoma or another disease that can affect your eye. Another cause of cataract is prolonged use of steroid medications like prednisolone, or any medication that's corticosteroid can make you develop cataract. So if you are taking those medications, you need to visit your ophthalmologist or your ophthalmic doctor once a year or twice a year. I mean, when you go to see them, they'll give you your next date of appointment, but it is very important that you see ophthalmic doctor if you're on prolonged use of steroid medication. Another cause of it is infection. Yeah, some infections can make you have cataract. So what are the signs and symptoms that you would see for you to know you are suffering from cataract? Number one, your vision becomes boring. Your vision become blurry, sorry. Loss of vision gradually. I mean, it doesn't really happen like in one day. No, it comes gradually. You start losing your vision, especially when you have like glasses. You first notice that your first glasses isn't reading properly. You start complaining about your glasses. You will think it's your glasses. Then you keep going for another, test for your glasses, and then it just keep getting worse. You should start noticing that cataract is coming up. You don't see well at night. You see allowed vision, you see double vision. Allowed vision means you might just be seeing the middle of the side of an object. You don't see the middle of an object, or you see an object and the other part of the object is flashing lights to you, because there are different types of cataract. So you might not just have the one that causes cloudiness. You might have, I will tell you that when I get to that. So when your vision is beginning to affect your activities of daily living, meaning that you can't do anything because you can't see properly, or at night you can't drive at night because your vision get worse at night, or when somebody suddenly you're reading a book and you can't see properly, you have to start straining your eye to see, then you need to go see your doctor because you might be having cataract. Now there are different kind of cataract. I have an image here that have different shapes and forms of cataract. If you look through this lens I'm holding, you will see something in the middle with a little two wings. That is a type of cataract. We also have another one. Anyone that have this type of cataract will probably see just the middle of an object and will not see the side of an object. This one here, they're going to see at the middle, but then the other ones start flashing into them. They start flashing lights into them. This is when the eye become like you can't see. There's cloudiness of the eye. You really can't see. You just see everything in brief, and the other ones you don't see. Sometimes you don't even see anything at all. And anyone that sees this, that has this type of cataract, won't even see anything on the side. You just see halo. You just see something in the middle. So when you are beginning to lose your vision like that, you need to see your doctor. And how do they treat cataract? It's really not very difficult, and I'm sure that's why most people don't want to go to the hospital, or they don't want to go see their doctor because of that. If you go to the hospital on time to see your ophthalmic doctor or your ophthalmologist, if your cataract hasn't really gotten worse, there is possibility of you just being treated with just an eye drop. I mean, but most of the time, so surgical intervention is the only solution, sometimes with different cases. And what do? Is they go into your eye to remove the affected lens and replace it with a new lens. Yes, it's possible. It's a very, very short surgery. It doesn't even take time. In less than 40 minutes, they are done. They just wash this out. They break the protein into particles. They wash it out. I've seen them do the surgery a whole lot of time because I have the opportunity to work in an ophthalmic unit. I've assisted a whole lot of doctors with cataract extraction. So they just break down those proteins, suck them out, and then they go in with a new lens and they stick it in, and then you start seeing again. And after surgery, the doctors just plaster the eye, just allow it to rest for some couple of hours. They start giving you eye drop every hour for another 24 hours, and then your ophthalmic nurse will give you an health education on what to do and what not to do after your surgery. Honestly, these are preventable, very, very preventable. But unfortunately, I've seen a whole lot of cases whereby when the patients will be presenting themselves to the hospital, the eye is gone already. So these are preventable cause of blindness. You don't have to be blind because of cataract. You can actually prevent it from happening. And that's what I say. When you have diabetes, and you need to know you have DM, number one, because if you don't know, you don't know. That's why I say all the time you need to check your blood sugar, maybe once in a month, once in 2 months, once in 3 months. And if you have it, if your doctor give you regime for your insulin, you need to adhere to it. Sometimes it's not even insulin, it's just metformin, and you need to take it regularly and just monitor your blood pressure, monitor your blood sugar level all the time. You know, See your doctor all the time. If your parents are getting elderly and they are beginning to complain to you about their vision, please don't take them to somebody that does glasses under the bridge. Don't take them to someone that will just give them a glasses to be wearing, because the truth is, it doesn't make cataracts better. It makes them read a little bit better, and then the same signs and symptoms will still be there. Just take them to see their doctors. They will see them and do the surgery, and after the surgery, everything goes back to what it should be. It's not that very difficult. Please, if you have any changes in your body, your eye, your body system, your hormones, anything that you see that is not peculiar to you and is beginning to crop up gradually, speak up, go see your doctor. I won't stop emphasizing on the fact that you need to do your physicals every year. Okay, so on this morning talk with Falakemi today, I would like to say thank you for watching us today. If you have any question, please do not hesitate to send me a DM or a direct message. I have that very good habit of answering people, and I promise you I will answer you. Don't forget to reshare all my videos and click the notification button for more video prompts. I love you and I remain myself. If you want me to do any video, feel free to send me DM and I'll try my possible best to do much research on it, and I'll come back and give you the feedback. I love you, and don't forget to share my videos. Have a nice day. Bye.